My name is Mike Stockdale and I'm a student at Lockhaven University, Clearfield. This video is going to provide information pertaining to the perioperative factors of a bilateral myringotomy with tube insertion. It will cover the indications or reasons why the surgery is needed, the steps of the procedure, and the information that you will need to know once the procedure is complete. This illustration shows a picture of both the normal middle ear and the middle ear of a patient that has otitis media or an ear infection. Ear infections are most commonly treated with antibiotics. While the antibiotics are an effective way of clearing up the infection, the fluid left behind from the infection may remain present in the ear for months. This fluid, while not as painful as the ear infection, may still cause discomfort and could also cause hearing and balance issues. Fluid is normally drained from the middle ear by the eustachian tube. However, during an infection, the inflammation can cause the lumen to close off. Another cause of the fluid buildup is the anatomical positioning of the eustachian tube. In infants and young children, the eustachian tube is sometimes level, which decreases the flow of the fluid from the middle ear. As the child grows, this tube will become more vertical, allowing the fluid to drain by gravity with ease. Here are some actual pictures of what the eardrum looks like with one of these scenarios. Here is a normal tympanic membrane. It's clear, silvery in color. Then we have the infected eardrum, which is acute otitis media, and it's red in color, and you can see that there's some thick fluid in behind there. Lastly, we have a otitis media with effusion, which is just the fluid behind the ears. The infection is gone. And you can see clearly now where the fluid is behind the ear because the eardrum is no longer infected or inflamed. An ENT surgeon may perform a bilateral myringotomy with tube insertion in order to remove or prevent fluid buildup, as well as to maintain the normal, proper function of the eardrum by removing the force pressed upon it by the fluid. This is usually a quick, non-invasive procedure that only takes a couple of minutes to complete. Typically, the surgeon will use a speculum and a curette to clean the earwax or cerumen out of the external auditory canal. Once the canal is free of wax, he or she will make a small 1 to 2 millimeter incision in the eardrum. If there is fluid in the middle ear, the surgeon will remove it prior to placing the tube. Once the tube is placed, he or she may administer topical antibiotic drops to the site. These tubes will remain in the ear until the body's healing processes push them out of the ear, or depending on the tube, they may need to be surgically removed. The tubes are designed to last a certain amount of time depending on the patient's needs. Here we have 3 different tubes: the tiny tuma, the Armstrong, and the T-tube. They are all made of polyethylene. The tiny tuma is designed to last 4 to 6 months, while the Armstrong is 6 to 8 months, and the T-tube is designed to last 2 years. Here we have the Reuter-Bobbin tympanostomy tube. It is made of metal and is designed to be permanently in place. It needs to be removed surgically. This picture shows how the eardrum will heal around the tube after a few weeks. Postoperative information is the last section of this video, and it will cover hearing changes, activity limitations, draining and discharge, pain control, eardrops, and general measures that will promote safety and prevent discomfort. After the procedure, it may take a few days for hearing to return to normal. Initially, it'll sound hollow due to the pressure changes. It is also very important to avoid physical activity for 24 hours after your surgery, as it could dislodge the tube from your ear. If you were to experience discomfort after this procedure is done, Tylenol and Motrin should relieve the discomfort. Be sure to follow dosing instructions from your physician. Under certain circumstances, antibiotic eardrops may be needed. When administering eardrops, have the child lie with their ear pointing upward. This will aid with the eardrop reaching the eardrum. After the eardrop is dropped in the canal, rub the front of the ear to help the drop reach the eardrum. Rolling the drops in your hand prior can also aid with the discomfort by warming the drops. When bathing, showering, or washing your hair, you should always try to keep water from reaching the eardrum. Plugging your ears may be accomplished in multiple ways. A large piece of cotton coated in Vaseline is one way to plug the ear. However, it is not the most preferred method, as it could get a little bit messy. Okay, so the putty style earplugs go in to the ear but not actually into the canal. They form inside the pinna. Sometimes these ones work a little bit better if you sort of pre-mold them to fit the patient's ear before you try putting them in. So this is a plastic earplug that is pre-fitted for the patient's ear. With these earplugs, you need to ensure that you are putting the earplug in the side it is meant to be put in. Ensure that the earplug is fully seated to prevent leaks as well. If your child is pulling at his earplugs while he is in the bath, a headband may be used to ensure he doesn't pull them out. Covering your ears when outside in cold weather may also help prevent discomfort. Lastly, drainage is normal in small amounts up to 48 hours after surgery. Call your doctor or report to the emergency department immediately if you experience a fever of 100 degrees or more, excessive bright red bleeding, pus drainage, or severe pain or discomfort. If you have any questions after watching this video, please write them down so you can ask your provider at your follow-up visit.